Why are patients with Parkinson's disease afraid to ask their neurologist for mucuna? It is totally normal to feel unsure about talking to your doctor about alternative therapies like mucuna. We understand your concerns. You are worried your doctor will be skeptical, disapproving, or even blaming you. Some patients are interested when they hear about others who have found natural remedies work. They are looking to see if they can take less or even stop taking conventional medication. But they do not know how their doctor will react, so they investigate these options on their own, using little information they find online. This is risky. It is important to have your doctor on your side when you are trying out new treatments, including mucuna. Without guidance, patients may unknowingly misuse or mix it with other medicine in ways that reduce effectiveness or increase risks. See for advice from a doctor. Meanwhile, in patient forums and even among some receptive doctors, there has been a growing idea that early Parkinson's can be treated with less conventional approaches, possibly delaying the need for standard drugs. It is important to remember that while drugs are necessary, starting them too early or at high doses can cause problems in the long term. There are other ways to explore too. For example, exercise is a fantastic alternative treatment for slowing down the progression of the disease. Parkinson's drugs are highly effective at managing symptoms, but unfortunately, some patients experience complications such as dyskinesias, uncontrollable movements, after several years. These are not caused by the disease itself, but by years of medication. Doctors have tried to delay the use of levodopa, such as Sinemet or Madopa, by starting with less potent alternatives such as dopaminergic agonists, such as pramipexole or ropinirole. However, these substitutes also cause side effects over time, including sleep disturbances, digestive problems, and impulse control disorders. On a more positive note, some patients have been able to delay the need for these drugs by making a few simple lifestyle changes, getting regular exercise, and even trying mucuna. The great thing about mucuna is that it can delay the need for conventional levodopa or dopaminergic agonists for years, potentially sparing patients some of the side effects. In my 30 years of practice, I have seen patients try natural options with hope and determination, even when they are unsure. Levodopa is a great drug when used correctly. It is also worth noting that because something is natural does not necessarily mean it is safe. It is a shame when patients try mucuna without guidance because they are afraid of being judged. Mucuna can be risky when mixed with other Parkinson's drugs. This is particularly the case when doctors may not be aware or interested in mucuna, perhaps because there have not been many clinical studies done on it yet. Despite all the research that shows its benefits, there is still not much interest. Another thing to watch out for is that products can vary in concentration, which can make dosing tricky. This can be a bit confusing for patients and doctors. Some manufacturers are making things worse by selling misleading products. This can lead patients to try things that are not safe. There are many mucuna products that vary in dosage and quality. Find a knowledgeable pharmacist and a practitioner who understands mucuna and how it works with other PD treatments. The doctor should guide you on dosage and timing. Don't try to self-administer mucuna. If you follow this advice, you might be able to delay taking conventional medications or use mucuna alongside conventional therapies under your doctor's supervision. This three-part strategy provides a safer, more rounded option for managing Parkinson's disease.
Mucuna versus Sinemet. Natural levodopa in mucuna pruriens. versus synthetic levodopa in Sinemet, a comparative guide for Parkinson's care. Imagine a world where the natural gifts of plants rival the precision tools of modern medicine. For Parkinson's disease, the choice between natural levodopa from Mucuna pruriens and synthetic levodopa in medications like Sinemet brings that decision to life. Which is best for you? Levodopa is the cornerstone of Parkinson's disease treatment. Both natural and synthetic forms convert into dopamine, the brain chemical that Parkinson's depletes. This essential dopamine boost reduces tremors, stiffness, and movement challenges. Yet, not all levodopa is created equal. Synthetic levodopa, like Sinemet, is rigorously manufactured. It's paired with carbidopa to limit side effects and ensure more dopamine reaches the brain. In comparison, Mucuna pruriens delivers levodopa straight from nature, alongside other bioactive compounds. Could this bring extra benefits? Synthetic levodopa offers unmatched consistency. Every dose delivers precisely measured amounts of levodopa and carbidopa, ensuring predictable symptom relief. However, nature is less controlled. Mucuna pruriens levodopa levels vary by plant batch. This variability may make symptom management more challenging for some patients. Mucuna pruriens contains more than just levodopa. It includes serotonin precursors, antioxidants, and essential minerals like magnesium and zinc. These compounds might boost mood, support nerve health, and reduce oxidative stress caused by Parkinson's progression. In contrast, Sinemet focuses solely on motor symptoms, leaving non-motor issues like anxiety and sleep unaffected. Both options can present gastrointestinal symptoms such as nausea or bloating. Sinemet often has fewer side effects in this area due to carbidopa. Meanwhile, Mucuna lacks this inhibitor, increasing the chance of digestion-related side effects. Mucuna pruriens may act faster than Sinemet, kicking in as early as 20 minutes after intake. Its natural matrix could allow a slower dopamine release, potentially providing longer-lasting relief. Yet, its effectiveness swings with dosing consistency. Sinemet excels in managing motor symptoms with precision dosing. But Parkinson's isn't just about movement, it affects mood, sleep, and cognition. Mucuna pruriens, serotonin, and antioxidants offer potential advantages in addressing these non-motor symptoms, providing a more comprehensive sense of well-being. Synthetic levodopa replenishes dopamine efficiently, but doesn't stop disease progression. It may even contribute to oxidative stress with prolonged use. On the flip side, Mucuna pruriens antioxidants and anti-inflammatory agents hint at potential neuroprotective effects. Though this remains scientifically unproven, more large-scale studies are needed. Mucuna pruriens could be a practical alternative in regions with limited access to synthetic medications. Its affordability and natural availability make it appealing for some. However, patients should weigh these advantages against the challenges of inconsistent dosing and the absence of clinical guarantees. If precise symptom control and reliable dosing are priorities, synthetic levodopa in Sinemet is unrivaled. But for those seeking a holistic approach or experiencing side effects from synthetic options, Mucuna pruriens may offer valuable supplementary benefits. The choice depends on your symptoms, lifestyle, and response to treatments. Both natural and synthetic levodopa have roles in Parkinson's care. It's not one or the other. Some patients may benefit from combining both under medical guidance. Regular monitoring and adjustments by a neurologist are critical to avoid excess dopamine and ensure symptom stability. Deciding between Mucuna pruriens and synthetic levodopa is personal. Discuss these options with your healthcare provider to create a tailored treatment plan. Whether you prefer nature's touch or science's precision, understanding your choices empowers you to live better with Parkinson's disease.
Understanding the risks of Mucuna pruriens for Parkinson's disease, a guide for patients. Mucuna pruriens, a natural plant-based source of levodopa, has emerged as an intriguing alternative in managing Parkinson's disease symptoms. However, while it offers potential benefits, understanding its disadvantages and risks is vital for informed decision-making, empowering patients to engage thoughtfully in their treatment under the guidance of their healthcare provider. Mucuna pruriens may sound appealing due to its natural label, but patients should remain cautious. Here are key considerations. Natural doesn't always mean safer. Herbal products, nutrients, or dietary supplements may contain other substances in excess of the benefits, which may have adverse effects on their own or by interacting with medicines. The levodopa in mucuna is chemically identical to that in synthetic medications like Sinemet or Madopa. Since mucuna pruriens contains levodopa, its side effects can mirror those of synthetic medications. These include nausea and vomiting. Levodopa can be converted to dopamine outside the brain, irritating the gut and triggering nausea or vomiting. Without a decarboxylase inhibitor, for example carbidopa, these side effects may be heightened with mucuna. Orthostatic hypotension. A sudden drop in blood pressure upon standing can lead to dizziness or fainting if large amounts of mucuna are taken, especially with the ultra-concentrated preparations. Dyskinesia. Prolonged levodopa use can lead to involuntary jerky movements. Dyskinesia is less common with mucuna. However, it may occur if high doses are taken for a long time. Neuropsychiatric symptoms. Symptoms such as anxiety, mood swings, vivid dreams, or hallucinations are less common with mucuna than with conventional drugs, but may occur especially in later stages of the disease or at higher doses. Patients must recognize that potential side effects from mucuna require the same vigilance and management as those associated with synthetic levodopa therapy. The complexities of Mucuna pruriens go beyond levodopa content, as it contains other bioactive plant compounds. These may cause allergic reactions. Handling or ingesting mucuna seeds or powders may cause skin irritation or rashes in sensitive individuals. Variability in levodopa levels between batches poses a challenge for predictable dosing, leading to fluctuating symptoms. Heart under pressure. Producing more dopamine outside the brain may increase heart rate, tachycardia, stressing the cardiovascular system. Patients in the following categories should avoid or consult their doctor before use. Cardiovascular issues. People with arrhythmias or hypertension may experience worsened symptoms. Mental health disorders. Mucuna may aggravate schizophrenia, psychosis, or severe mood disorders. Gastrointestinal diseases. Conditions like ulcers or Crohn's disease could worsen with mucuna's digestive side effects. Diabetes. Mucuna may interfere with blood sugar levels, complicating diabetes management. Bruising risk. Altered blood vessel dilation may make some patients more prone to bruising. Medication interactions. Combining mucuna with antidepressants or antihypertensives could lead to dangerous responses, such as blood pressure imbalances or reduced effectiveness of antipsychotics. Inconsistent levodopa content. Mucuna's variability in levodopa content may amplify these fluctuations, underscoring the need for close dosage monitoring. Access to mucuna products can be restricted due to levodopa regulations or unclear labeling. These challenges may disrupt treatment continuity and require consideration when deciding whether to rely on mucuna. The main health risks of Mucuna pruriens are associated with long-term use without medical supervision and in high doses. Highly concentrated mucuna products, more than 50%, sometimes 99%, are particularly dangerous, even more so if they are in powder form. In these cases, the risk of overdose is very high. In addition, at such high concentrations, almost all of the levodopa is lost, and the benefits of the plant have been compromised by a very artificial extraction process. Patients should approach mucuna with realistic expectations and prioritize discussions with their neurologist or movement disorder specialist. The right Parkinson's treatment balances potential benefits, known risks, and personal health factors. If you find out all you can about Mucuna, buy a reliable product and take it under medical supervision, you will be able to obtain all the benefits that this plant can provide for many patients.
What Mucuna should I buy? Good morning, Dr. Maldonado. You diagnosed me with a mild form of Parkinson's disease, and for now I prefer not to take any conventional medication. You recommended exercise, fresh air, and a change in my lifestyle, a more relaxed and optimistic attitude. We also discussed the possibility of starting with natural levodopa from Mucuna pruriens. There are many Mucuna products, and I have several questions to ask you if you don't mind. Firstly, is it true that some Mucuna products do not state how much levodopa they contain?
Unfortunately, it is. Many Mucuna pruriens supplements fail to clarify the exact levodopa content. This is vital for people with Parkinson's because no clear labeling can mean underdosing, leading to insufficient symptom relief, or overdosing, leading to nausea, dyskinesias, or cardiac problems. It also complicates combining Mucuna with existing medications. My advice: choose reputable brands whose labels clearly indicate the total amount and percentage of levodopa, and always seek guidance from your doctor.
Is all the information on Mucuna labels accurate?
Sadly, some manufacturers exaggerate or misrepresent levodopa levels in their products. In a piece of work that I discussed with one of the authors, Tanya Denner, several well-known brands of Mucuna were analyzed, and it turned out that they did not contain the levodopa that they claimed, and the variations ranged from just 6% of what was claimed to 140%, which was more than expected. This can lead to lower levodopa than advertised, resulting in inadequate symptom control. Higher levodopa than stated, increasing the risk of side effects. Such inconsistencies make proper dosing nearly impossible, even for healthcare professionals trying to help. Hence, it's essential to look for standardized Mucuna from manufacturers that perform reliable laboratory testing.
Why is a certificate of analysis so important?
A certificate of analysis, COA, means the product has been assessed by an independent laboratory, which verifies the quality and safety of the supplement, ensuring it meets the required standards for consumption. This is particularly important for Parkinson's patients considering Mucuna pruriens, as proper labeling and verification are crucial. The real percentage of levodopa. The absence of harmful contaminants. If a manufacturer does not provide a complete COA, or if it's missing critical information, the safest approach is not to purchase the product.
What should I look for when buying Mucuna?
1. Standardization and levodopa content. Quality supplements often range between 5% and 40% levodopa. Ideally, the label states exactly how many milligrams of levodopa are in each capsule or per gram of powder. 2. Reputable brands that undertake rigorous quality control and provide laboratory verification. 3. Minimal additives. A high-quality Mucuna product should primarily contain the Mucuna pruriens extract without unnecessary fillers. 4. Form, capsules, more precise doses, or powder. Requires careful measurement with a digital scale. 5. Medical supervision. Especially if you are taking levodopa-carbidopa. It is imperative that your neurologist adjusts the dosages as there is a risk of overdose.
Does the way I take Mucuna change its effects?
Of course, Olivia, whole seed powder often absorbs more gradually, but levodopa levels can vary, making dosage less accurate. Standardized capsule extracts provide a predictable levodopa dose with consistent symptom control, though they may act slightly faster and can peak more noticeably. Highly concentrated extracts Potent but small dosing errors might cause stronger side effects. When switching forms, start with a lower dose, then carefully titrate under medical guidance.
Are lower concentration products safer and more natural?
Less processed forms often retain more natural compounds, antioxidants, amino acids, which might help reduce side effects and offer a gentler effect. However, natural variability means you might need larger amounts to achieve the desired therapeutic effect. In every case, medical supervision is essential to track benefits and side effects, regardless of concentration.
Does it matter if mucuna is raw, processed in tablets, or made into a tea?
Yes, the form of mucuna impacts its absorption and the amount of levodopa delivered. Raw or ground seeds, highly variable levodopa levels, possibly lower absorption. Extracts, more potent, standardized and consistent. Capsules, tablets, can help maintain stable dopamine levels with controlled dosing. Teas, decoctions, hard to know how much levodopa you're actually getting. Products mixed with other ingredients. Additional substances may alter levodopa's absorption and effects.
How do I store my mucuna so it remains potent and doesn't blacken?
Keep it in a cool, dry place, ideally at around 20-25 degrees Celsius, away from direct sunlight. Use airtight containers to protect from moisture, which accelerates levodopa oxidation, often leading to a dark or black appearance.
How do national regulations affect importing mucuna?
In many countries, levodopa is classed as a prescription medication. Products with higher concentrations can exceed permissible levels. Essentially, levodopa regulations, safety concerns, and labeling often determine whether such products are allowed entry. For those living with Parkinson's, Mucuna pruriens can be an interesting complementary option, but never a substitute for conventional treatment. Remember, there are no miracle solutions or definitive cures yet. However, with proper advice and a responsible approach, we can make use of both traditional and complementary tools to enhance quality of life. Thank you very much for your attention.
Is Mucuna pruriens only for the poor? Mucuna grows wild where the poor cannot afford Sinemet. There it is, the only option for people with Parkinson's, so no one argues against its use. I am Dr. Maldonado, a neurologist specializing in Parkinson's disease. I have an academic background and use conventional treatments, but I keep an open mind to unorthodox options. The best one is Mucuna pruriens, a tropical legume with naturally occurring levodopa, the same gold standard in Sinemet or Madopa. Many patients who use Mucuna have been disappointed by a recent interview with Dr. Roberto Cilia, a renowned neurologist whom I follow and admire. He discourages the use of Mucuna in Western countries. However, he strongly supports it in poorer regions where synthetic levodopa is prohibitively expensive or hard to obtain. In broad terms, I agree with his position with some important nuances to consider. First and foremost, Mucuna works. Famous neurologists such as Warren Olino and Andrew Lees are the ones who have registered Mucuna extracts as a treatment for Parkinson's patients. In various small clinical and observational studies, patients have often reported improvements in motor symptoms that are comparable to or better than those achieved with standard levodopa/carbidopa formulations, Sinemet or Madopar. And even without scientific protocols, Mucuna has been used safely and effectively in traditional medicine for more than 2,000 years. For nations where incomes are low and access to medications is scarce, Mucuna pruriens is a lifeline by 3 primary reasons. 1. Cost of synthetic levodopa. Standard PD drugs like Sinemet or Madopar may be priced well beyond the average monthly salary, making them unaffordable. 2. Abundant local supply. Mucuna grows spontaneously in many tropical climates, and local harvesting can provide a natural, cost-effective source of levodopa. 3. Evidence-based necessity. In such circumstances, arguing against Mucuna would be short-sighted. If it's the only realistic option for many patients, then it fulfills a critical therapeutic need. That said, the situation changes in Western or more affluent nations where synthetic levodopa is readily available. Dr. Celia's stance, that Mucuna isn't recommended in these settings, stems from practical and regulatory considerations. 1. Poor quality control. Mucuna products found on the market often provide scant information about their composition. Labels may not always match what's inside the bottle, with levodopa concentrations fluctuating wildly. 2. Risks due to dosage errors. Some batches may contain less than advertised, leading to underdosing. Others can have more, risking accidental overdosing and interactions. When combined with carbidopa or benzerazide, potentially quadrupling its effect. 3. Doctors are frequently unfamiliar with Mucuna or dismissive of it because it isn't part of standard treatment guidelines. In addition, because it's not officially recognized, prescribing it can carry professional and legal risks. 4. Enthusiastic patients who are intrigued by Mucuna often struggle to find a physician willing to guide them. 5. Without professional oversight, these patients rely on piecemeal advice from internet forums or personal testimonies, which can be incomplete or misleading. These are serious barriers, and they explain why many Western specialists prefer the tried-and-true route of prescribing synthetic levodopa formulations that have undergone rigorous quality control and standardization. Despite the obstacles, I believe there is still room for Mucuna in Western countries, provided we address the above limitations effectively and responsibly. Here are some proposals to ensure patients' safety and well-being. 1. Look for trusted laboratories or suppliers that offer clear quality certificates, ideally with third-party testing. 2. Ensure they list the exact levodopa concentration in their capsules or powders. 3. Favor products of low or medium concentration over ultra-concentrated ones because precise dosing is critical for levodopa therapy. 4. Search for a physician or advanced practitioner who is open-minded about alternative approaches and has studied Mucuna's properties. 5. Monitor therapy. A professional take the control with the patient, keep track of symptom changes, and adjust doses to avoid complications. 6. Patients should have a thorough understanding of both Mucuna's benefits and its risks, including potential side effects, drug interactions, and the importance of consistent dosing. Adequate information also arms the patient with realistic expectations and helps them avoid internet miracle cure pitfalls. When these measures are in place, Mucuna can be integrated safely and effectively into a broader Parkinson's treatment plan, complementing, not necessarily replacing, conventional medications. One of the most exciting developments on the horizon is Dr. Celia's multi-center trial in several low-income countries. This project will involve hundreds of patients with Parkinson's disease who will be systematically monitored while taking Mucuna. Positive results on efficacy and security of Mucuna should reinforce its position as a legitimate PD therapy worldwide, not just in resource-limited settings. Imagine an FDA-endorsed Mucuna formulation with guaranteed potency and purity. That might give doctors the legal and ethical backing they need to feel comfortable prescribing it, thus increasing patient access in wealthier countries as well. This will lead to the acceptance of Mucuna by the medical community in all countries, and I am sure will benefit people with Parkinson's disease. I have a dream. My dream is for all people suffering from Parkinson's disease, rich and poor, to have a powerful and safe Mucuna controlled by doctors. Questions about Mucuna and Carbidopa. Olivia is a Parkinson's patient, elegant, studious, and very curious, who always asks me the most complex questions. I try to answer comprehensively.
Doctor, how do the blood-brain barrier and decarboxylase inhibitors affect levodopa treatment in Parkinson's disease?
That's an excellent question, Olivia. The blood-brain barrier is like a tightly controlled gateway. Dopamine itself can't pass through it, so we use levodopa instead. However, if we give levodopa on its own, too much of it can be converted into dopamine outside the brain. That causes side effects, such as nausea, and means less levodopa actually reaches the brain. Decarboxylase inhibitors, like carbidopa or benzerazide, block the enzyme that converts levodopa to dopamine in the body's periphery. They don't cross into the brain, so once levodopa reaches your brain cells, it can still convert into dopamine effectively. By using a decarboxylase inhibitor, we reduce peripheral side effects and can use lower doses of levodopa overall, making treatment more efficient and tolerable.
What happens if Mucuna is combined with carbidopa in Parkinson's disease?
Mucuna pruriens is a natural source of levodopa. When we add carbidopa, a decarboxylase inhibitor, we further reduce the breakdown of levodopa in the body before it enters the brain. This combination can lead to more levodopa crossing the blood-brain barrier, potentially giving extra symptom relief. However, there is a risk of excessive levodopa levels if we don't dose carefully. Dyskinesia, nausea, tachycardia, and more, as Mucuna products can vary in their levodopa content. In this way, the natural levodopa from Mucuna would have a more effective and lasting action in the brain, and the peaks and valleys caused by its other ingredients would be avoided. Of course, individual responses vary.
I've found that using very low doses of carbidopa, around 8 to 10 milligrams, I can reduce my Mucuna to a quarter of the usual amount, and it lasts at least 14 hours. Is that really possible?
It can be. Even at lower doses, carbidopa still blocks peripheral conversion of levodopa. That means more of the Mucuna's levodopa crosses into your brain. You end up needing less total Mucuna to achieve the same effect, and the benefit can last longer.
I've seen 2 regimens that achieve the same clinical response: 450 milligrams Mucuna levodopa 4 times a day, or 150 milligrams Mucuna levodopa 4 times a day plus 8 milligrams carbidopa once a day. Which one is superior?
Both can work, but there are differences in how they balance efficacy and side effects. High-dose Mucuna without carbidopa might control your symptoms, but you're at greater risk of peripheral side effects since more levodopa is broken down before reaching the brain. In contrast, using a lower dose of Mucuna combined with carbidopa can reduce those side effects because carbidopa prevents the breakdown of levodopa outside the brain. Often, you can achieve the same or better symptom control with a smaller total amount of levodopa.
Does it matter if you take carbidopa first and then Mucuna half an hour later, or the other way around? And how long does carbidopa last?
Timing can definitely matter. When you take carbidopa 30 minutes before your levodopa source, whether that's pharmaceutical levodopa or Mucuna, you allow carbidopa to start working in the bloodstream, blocking peripheral enzymes straight away. That means more levodopa is preserved to cross into the brain. If you take them together, the overall effect might be slightly less potent. If you're sensitive to side effects or have fluctuating symptoms, that half-hour gap may help. As for duration, carbidopa's half-life is around 2 hours, and its inhibitory effect can last 4 to 6 hours. If you're only taking it once a day, the strongest effect is in the first part of the day.
I've read about green tea potentially increasing Mucuna's effects. How does that compare to carbidopa?
Green tea contains a substance called EGCG, which can slightly inhibit enzymes that break down levodopa outside the brain. It also inhibits an enzyme called COMT, which normally breaks down dopamine. Some patients do notice modest improvements when taking Mucuna with green tea. However, it's no match for the potency of carbidopa, which can boost levodopa availability by several times.
Do soya, black pepper, lemon juice, or other natural substances increase the effects of Mucuna in the same way carbidopa does?
These substances can be part of a holistic approach, but none replace the targeted action of carbidopa. Olivia, I hope this helps you see how Mucuna, carbidopa, and these other substances can interact. However, always remember to have a doctor's check and remember that each person's reaction is unique.